tell me
Hello.
My name is Ross
And can you tell me what day
Marigo, and
of
I'm
the
a
week it is?
student at Penn State Hazleton.
Perfect.
Is it okay if I
Before
work
we
with
get
you
started,
today?
we're doing
Yes.
ultrasound today. I
Nice,
just wanna
nice.
quickly
Can I
kinda
get your
explain what
name and your
ultrasound
date of
is.
birth?
So
It's
a tool that we're gonna
Matt Ganji, my
use
date
with a
was
certain
3/7/2000.
gel on it.
Okay,
That's
and
gonna
do you
help
know where you
elicit
work
a
in?
thermal
Penn
response.
State
So we
Hazleton.
can use it to
And what day of the week?
increase some
Today's
extensibility in your
Thursday.
tissues.
Okay.
You
Great,
got 2 out of
great.
10 pain.
So I think
worry about
you're
pain, but just kinda stretch things out
cognitively
and
here,
loosen things up.
which is good.
Some expectations
so
for you.
do you know where
Since we're gonna be
your
using heat, you
pain
should feel
is
gentle
right
heat.
now?
If it gets too hot,
So it's just at my low back area, and it's kind of like at a
And then,
let's say a 3
included
out
with
of
that,
10,
that
just
you're
like
feeling tingling,
mild
so when
discomfort, I
you're
would say.
doing it,
Okay, okay.
Alright, cool.
And then,
Just before we get started,
Sorry.
we're gonna talk about some precautions.
so it goes pain.
just right now, my patient is cognitively aware.
and you're here because you have lower back pain. All
Um,
right, so
do you know
today
any
what we're going to be
sensation
doing
issues that you
is
have? Any
traction.
sensation?
Okay.
And then traction is just a process of just some slight pulling
You have any
on
fractures?
your,
Nope, okay, so
some
you're good.
slight
Do you have any
pulling on your
rest?
body just so we can
And
stretch
then,
out your spine and make
you're
some more
pretty
room
much grown,
between
but
the
we're gonna do it for any
vertebrae.
physio place,
And then
right?
you have
And then some
degenerative joint
contraindications.
disease,
I've
and
asked
this
a
is
couple
supposed to
questions. Are you
help
pregnant?
with
Do you have cancer?
decreasing nerve root
lack of
compression
sensation?
that might be causing any
Okay.
more pain.
Lack of circulation.
But
in your
before
ears,
we
so
get
you're-
started with
No.
that,
Do you have any blood clots?
again,
You have.
you're gonna have, you can
laminectomy?
expect to
We're
feel
not gonna
some
do no
force
spinal cord.
on
Do you have any
your
infection
spine,
in
but
your
you should be experiencing no pain.
Okay.
Do you have any
Alright.
acute inflammation / edema? in
So
your
other
hip?
than that,
Okay.
I'm
You
gonna
have a
ask
pacemaker?
you, do you
We're not
have
gonna be doing
any
carotid sinus. We won't be doing
spinal
the eyes and the
infection?
central nervous system.
Do you have history of spinal cancer?
Nope.
Do you have rheumatoid arthritis?
Nope.
Do you have any joint
Osteoporosis?
replacement in
Nope.
the area?
Fractures?
Cement?
Nope.
No. Okay.
Abdominal pressure pain?
Nope.
Do you have any active bleeding in the
ligament
area?
strains?
No, you're good. Okay.
Nope.
I see
Acute
CNS,
injuries?
and then we're not gonna be going
How about
over
any
it.
traction anxiety that I'm?
So that's all
Nah,
the
no.
contraindications.
Do you have any
Before we get
cardiac
started, we're gonna do a hot
respiratory
and cold sensation
insufficiency?
test.
No.
So if you could just pop
I
up
know
your
you're not
stomach for me
pregnant.
on the video.
Okay.
T-
I'm glad you checked.
but do you have any history of TMJ?
No.
Okay.
And how about some
So
type
how
of
we're gonna do the
neuro?
hot and cold
No.
test is I'm gonna practice
Okay.
on the left side
Great.
first to test the non-infected side. This
So what are
tube
your
right here,
goals
that's the
for
hot
other?
sensation,
What are your
and
goals
this
for
tube here,
further
that's the
treatments
cold
and physical
sensation.
therapy?
Place it
Much just
on
like
your
to
leg, you
relieve
tell me
some
which one it
discomfort
is,
today,
okay?
maybe
Okay,
decrease
so if you
that
could just
pain
close
a
your
little
eyes
bit.
and look towards
Okay.
the camera
Just
for me,
like
just so I know you're not
feel
cheating.
better when I'm
So
doing
I'm just
my
gonna roll this
daily
up ever so
activities at
slightly.
home.
Okay, nice. And then
What tube is this? Alright, what tube is this?
I did that.
Alright, what tube is this?
So before we get started, I just need to look at your back.
Okay.
you're
If
good.
you could
Nailed
just
it.
stand
10 out
up
of 10.
and then face
I
me.
used those same two views.
I mean, turn the other way.
Okay, so you're hot.
Away.
and,
Yep.
cold
And then
sensation
what I'm gonna
test
do
you have
is that I'm
sensation
just
in the
gonna
area.
check for your skin and make sure that everything's
Just
intact
to
on
do
your
a
back,
couple more
okay?
things,
Go ahead.
inspecting
Alright.
the skin, there's no cuts,
So
there's
the
no,
skin
you
seems
know,
to be
damage,
intact,
your
but I'm
skin
gonna
is
do
intact,
a
it's looking
slight
good.
pressure
No
test, and I want
discoloration,
you to
nothing
tell me whether it's light or deep.
Okay.
All right. So
If
then,
you had to, can you point to where your
That's
pain's at?
deep.
okay.
That's
Your right-
like
your right
Uh-huh.
side.
deep.
Alright.
Light.
So like right in here?
Light.
Would you say that your pain's
Deep.
anywhere over here?
Nice.
No.
So you do seem to have sensation in your back, which is
A
good.
little bit. So like.
So
this
based
general
off of
area?
the data that
Okay,
I
so
have
your pain's right there,
gathered
and if you had to rate that pain
today,
on a scale from 0 to 10.
it seems
0
like
being no
you're
pain,
good
10 being
for
the worst pain in
traction.
your life, what would
But
you say?
before I even move
Seven,
on
okay.
traction,
It's
I
good.
never asked you
Alright.
how your pain affects you in your life.
Oh, you have 2 out of 10 pain. that's not too
It's
bad,
just
we'll
kind
take
of
care
like,
that.
I would say annoying to like deal with when
Real
I'm doing
quick,
like
for
chores
the
around the house.
hamstring,
I kind of like definitely feel when I'm bending over, you know, stuff like that, just trying to pick up objects, stuff like that, yeah.
Okay, and what was your rate of pain from 0 being no
If
pain
your
to
range
10
of
being the
motion
worst
is
pain you
good.
felt in your life? What's your pain
And
level?
then
I would say it's a 3 out of
finally,
10.
before we
3
start
out of 10?
treatment,
Yeah.
with this
Okay.
contusion to your
All
right hand,
right, and then
your
again,
ADL
hopefully
that
this
has
will
been
help
affected, so anything that you do in the day-to-day,
pull some pain pressure or pain feelings off.
Okay.
We'll reassess after.
Okay.
So I did that, pain assessment, like deep.
Okay, now we're gonna
Alright,
get ready for
so,
treatment.
set up my
So basically with
parameters.
treatment, I'm gonna be.
Alright, now that we're moving on to the traction machine, this is the traction machine. If you could please sit down here.
Okay.
Alright, and then now you can put your head down here.
Okay, we're just gonna smooth out the area.
Alrighty. And then I'm going to palpate for your
Where you feel that
iliac
gel, that's the
crest.
general
Could
area
you
of
do-
your pain, right?
I'm just gonna palpate real quick.
Go ahead.
You don't wanna have any scooping.
Okay, can you do a quick bridge for me?
I don't wanna do. Okay, so set my parameters.
Sorry, can you bridge down? You're stepping on the wire, so. No, you're fine, that's my fault. Okay. Bridge up again?
Intensity up without crossing the
Okay.
arms. And then I would be here on the one intensity
All
for
right, you can
19
lay flat.
minutes. Slowly moving around and making sure not to scoop up any of the gel. So we'll say 19 minutes went past. I would turn down my intensity while moving. Turn off the machine. Then I'd be able to take the sound head off.
Sorry.
Wipe it off. And then wipe off the patient's leg. How did that treatment feel?
I'm working on my body mechanics, so you can't grade me for that.
None of
There
that
we go.
tingling, none of that pain? Nope. You can lift your leg up for me now?
Okay,
Okay, see, go over
there we
here.
go.
Alright, just to kind of
Okay,
finish up,
so
we're
now
gonna
that
go
we
through a
got
couple
that
of those
done,
things that we did in the
I'm
beginning.
going to
So
palpate
looking
from
at
your
it, your
12th
skin
rib,
is still intact, it's looking good, no adverse
which is
reaction.
around here.
Can you show me
Can you
that
do
range
another
of
bridge
motion
for me?
one time, when you bring your leg back and then down? One more
All right,
time,
you can lay down.
Perfect, looking good. Your pain, can you still show me where that pain's kind of located at?
Can you breathe in?
Calm down.
And then
Down in
breathe
this
out.
area, if your pain was at a 2 out of 10 before we started treatment, what would you rate
This
your
is
pain
supposed to
on a
feel
scale
snug,
from 0
just
to
so you
10,
know?
0 being no
This
pain,
feels
10 being
snug.
no
Okay, but not too
Zero,
tight.
so if your pain's gone down.
Okay,
Good.
breathe in,
And
breathe out.
then for a home exercise
Very
bag, what I
nice.
want you to do, if you have a hot
You can
pack at
put
home,
your
throw another
arms
arm in
through
place,
here.
hot pack on your back of the thigh there. Just make sure when you use a hot pack, don't use it for 15 minutes at a time, and that you place
Put your
6
arm
layers
here.
between your skin and the
Great.
hot pack, so you don't burn yourself.
And then what I want
Make
you to
sure you're
do
checking
is
your-
if you
your
can
skin
scooch down,
frequently to make sure there's no
keep
burns, no
scooching,
adverse reactions. So if you
keep
feel something's wrong
scooching.
with it, make sure you take the hot pack off.
keep scooching.
Fair? Okay, just do that once a day.
And I'm double checking that this table is locked, which it is locked.
And then I wash my hands.
And
How's that? I think
there
that's
we
good.
go.
How long is it?
I'm gonna get you a pillow for your head. Are you comfortable?
I will be now,
Oh,
thank you.
no problem. We're doing Fowler position. So, can you lift your legs up for me, please? Actually, I'm sorry, I apologize. Keep them up. Alright. Can you move your legs closer to you? Good. Let me just move this up the crack. Push your feet forward a little bit. Very nice. Are you comfortable?
Yeah, that's fine.
Okay.
I know. Ultrasound is a tool.
I'll get you two though.
So then I'm gonna hook this up. Let me get a bell for you. So your treatment time is set for 20 minutes. I'm gonna stay here for a little bit for like the first couple of steps, but if I walk away, this bell is for you to call me over.
Okay.
And then when I start this machine, this is your like panic button. It stops the machine if anything goes wrong.
Okay.
So if I want you to hold on to that. And then I'm gonna release this. Oh, well, I already took a picture. Okay. Okay. I'm holding. Great. Alrighty. You hit your panic button. How do you feel?
I feel pretty good.
Alright, nice. So I'm gonna unstrap you, but before you get up, what I want you to do is you need to sit completely still and allow yourself to be oriented before getting up off the table. Okay? Alright, I'm gonna take this off. You can lift your feet up. Alright. When you're oriented, you can sit up for me. And then, can you stand over here for me? I'm gonna do a post-assessment of your skin.
Okay.
Can you, so I'm just gonna, there's a stool here. Body mechanics. All right. Do you have any pain?
Nope.
Your skin's still intact?
Yes.
Great. Can you bend forward for me? Any pain with that?
Nope.
Can you bend backwards for me? Any pain with that?
Nope.
That's great. That's great. So if you have any pain or tightness in your back, just put a hot pack on it.
Okay.
You know, do you have a hot pack at home?
I do have one actually.
Okay, so then I would just use the instructions that the hot pack says, but
Okay.
like don't make it too hot,
Sure.
and then only do 20 minutes at a time.
Okay.
And I recommend you probably do this at the end of every day. Yeah, at the end of every day. For whenever you need it, if you're feeling tight.
All right, I understand.
Is there any other, what's your pain level now?
Actually decreased a little bit too, 10 out.
Nice, okay, okay. Any other questions you have for me?
Nope, I'm good.
All right. Thank you for working with me.
Oh, thank you.
No problem. Bye.
Bye.
Okay.